Congressman Tim Murphy, thank you so much for taking time to be on the program.
It's great to be with you. Thank you for having me.
Now, Congressman Murphy, you've been a leader in the U.S. House on mental health issues. Drawing, of course, from your private sector experience. Can you talk about your major initiatives in Congress on mental health right now?
Well, as a psychologist and as the only elected federal official who is a practicing mental health professional, I really had to take on this issue, which affects 60 million Americans who at any given year may have some diagnosable psychological problem, from very mild to the very severe, or those 10 million plus Americans who have severe mental illness. It is a drain on us in terms of lives. It is a drain on our economy, it is a drain on our workforce, and it's incredibly painful. When you look at the costs, serious depression alone costs us about $190 billion a year in lost productivity in the workforce. Overall, the healthcare and judicial costs of mental illness and substance abuse problems is about $500 billion per year. In the workplace, it affects the workplace in terms of presenteeism. People really lower the productivity remarkably, where even one individual who is seriously underperforming because of mental illness that they may be dealing with, or a family member that just depletes their energy, that could be about 30 days a year of lost productivity with that employee. And then you have absenteeism that comes to the two. We see how healthcare costs go up from it because someone with serious depression or depression problem in the workforce actually costs more than heart disease for a person as well. So you have these costs that have to be dealt with, and we're not very efficient in doing this. Why? Because we don't have places to help people. When we closed down the institutions of the 1950s and 1960s, those places were there starting in the 1800s to be a more compassionate place for someone with mental illness, before we had medications, etc. Once we had big medications breaking through, we no longer needed the 550,000 hospital beds we had in the 1950s. We shrunk that down, but we shrunk it too much. Now we have less than 40,000 beds for twice as many people as we had in the 1950s, 320 million Americans. It's not enough. It's not enough by about 100,000 beds. So where do people go? Prison is the number one place for many people with severe mental illness. Our prisons, majority of your county jails are mentally ill people, 60, 70, 80%. The majority of people in the state penitentiaries and federal penitentiaries, around half, have a mental illness problem. And about 80% of them get no treatment at all. A number of them may be taken to the emergency room, where emergency room doctors say that almost 8 out of 10 of people with some entry into the emergency room have a problem that, if related to their mental illness, if that mental illness had been treated, they never would have shown up there. But they take up space while the emergency room is trying to find a bed for them. But there are not beds because we have so few. What does that do? Think of this. If a person's in a psychiatric hospital during their crisis mode, it may cost $500 or $600 a day. Emergency room, $2,000 or $3,000 a day. And if they're just sent to a general hospital bed upstairs because they have to have room in the emergency department, that may be $1,200, $1,500 a day. So it's more expensive there. And quite frankly, it's cruel because many times they have to tie people to a bed.
It's not the proper environment for treating a patient awful. With that kind of condition.
Yeah, you can't treat a heart attack in jail, and you wouldn't just treat a heart attack by sedating someone and tying them to a bed. The other place we leave them on the street is the homeless. We send them home with telling families nothing about what to do, and so oftentimes they don't follow up on their medical conditions or other things. And of course, they fill the county morgues. The body count is staggering. In the year 2015 in this country, 43,000 deaths by suicide, 47,000 deaths by drug overdose, at least. 1,000 deaths by homicide of someone who's mentally ill. About 250 deaths by a mentally ill person in a violent police encounter. And then you also had the mentally ill who were homeless and died early, hypothermia or some other problem. But the biggest group, the fact that the mentally ill, the severely mentally ill, tend to have at least 75% have at least one chronic illness, 50% have at least two. And we're talking heart disease, lung disease, infectious disease, diabetes, etc. They tend to die 10 to 25 years sooner. So the body count in the United States in 2015 was estimated to be at 350,000 in 1 year. And that, by the way, is more deaths from mental illness in 1 year than the total combat deaths in the United States in World War I, Korea, Vietnam, Desert Storm, Iraq, and Afghanistan combined. It's awful. It's terrible what we do. But the good news is we can do something about it. Not the current system in the United States, because our federal government is so inept. We've got 112 federal agencies and programs that deal with mental illness. They don't talk to each other. They don't coordinate. We've got 26 homeless programs that aren't, some work, some don't. Why we have such duplicity, I don't know. But we have found in 2 Congressional Budget Office reports, or General Accounting Office reports, et cetera, that it's not working. They don't talk to each other. It's ineffective. It's inefficient. They don't even collect data on grants they give. We don't even know the effect of what they do.
That's criminal that they don't even collect the data, much less analyze it.
They don't.
Appalling.
So when we say, with Medicaid, for example, here's our tax dollars, 5% of people on Medicaid, which are the mentally ill, account for 55% of all Medicaid costs. And if we instead provided services for them, targeted them, helped them out, it'd be much better. But since a mentally ill person tends not to follow up very well, it's a struggle for them. And so they may not see the doctor. I mean, they may not have follow-up. So it doesn't make sense in terms of compassion, and it certainly is a massive waste of dollars. So that's why I've introduced legislation to change this whole thing, to restructure the government, to create an office of the Assistant Secretary of Mental Health and Substance Abuse, to have oversight over all these agencies, bring them together, eliminate the redundant ones, build up the ones that are effective and efficient, and get them to work together, to change some of the laws on how we distribute grants so there is follow-up, to ask states to be giving us more reliable information so we can really track that individual who starts off early on that we could have helped, but when we don't, they fall through the cracks, they end up costing the health system more in terms of medical and physical medicine dollars, going to the criminal justice system. That is so expensive. It's to this level of expense, it costs 20 times more to incarcerate a mentally ill person than to give them outpatient care. A mentally ill person in prison compared to a non-mentally ill person, same crime, costs 4 times more to have that person in jail than the other because they just keep having more and more problems. So we can fix this system if we do it right.
Yes, and I remember having conversations with John Wetzel, Pennsylvania's Secretary of Corrections, about this issue, and that is one of the biggest burdens on our correction system, that they can't even get to that process of helping people in jail to turn their lives around, because that burden of people who are mentally unwell or chemically addicted is just so overwhelming among the prison population. And again, it goes back to your point that the absolute deinstitutionalization left us with not enough hospital beds to care for those people who are seriously mentally ill, who should be in that kind of environment rather than being in prison.
It is, and the sad thing is we treat animals better than humans. So when we say that we're going to let people out of prison because they had arrested for a drug problem or they're mentally ill, what we do, we just send them out on the street. Good luck. They don't have money. They're not trained for jobs. They don't have educational support. They don't have housing. We send them out of there.
They have no social network.
It's just not there. It's not working. Because we say, well, if you want help, we're going to let them ask for it. But they don't understand. They have serious problems. On the other hand, if the barn is too crowded, you don't let the horses out into the street. You let them out into the corral. At least, and you keep feeding them and taking care of them. And that's what I mean. We treat animals better than humans. And out of some kind of a phony name of compassion, but we're not very compassionate. Every family is affected by this. Everybody knows someone in themselves, their immediate family. It's not maybe 1 or 2 degrees separation. And if we don't do something about this, we're going to continue to harm more people and cost a heck of a lot more when we could be turning lives around to be more productive and be part of the rest of the citizenry instead of just ignoring them like they're some flotsam and jetsam.
Yeah, well, and certainly, Congressman, I appreciate your sense of urgency about this, because this is, as you know from your own practice, this is not an abstract question. These are real people who are suffering right now, who need help urgently. And I also wanted you to expound a little bit about your efforts with the with gun violence, with trying to help keep firearms out of the hands of people who are dangerously mentally ill.
Sure. Most mentally ill are no more dangerous than the rest of the population, but those with severe mental illness, who have a history of violence, or particularly if they're using drugs or alcohol, are and they're not in treatment, are 15 times more violent, more likely to be engaged in violence than the rest of the population. If we focus on providing care and not letting people slip through the cracks, again, that means we're not saying, good luck, you're on your own, but wrap services around them. It makes a massive difference. You can actually reduce reincarceration and rearrest by about 75% or more if you provide those services. When we don't, we're just feeding the flames for future violence. In a couple levels. One, mentally ill and mentally ill children may be 4 to 6 times more likely to be assaulted, abused, sexually abused, victims of fraud, etc. So the victimization is very high. But those who have a propensity towards violence and they're not treated are the ones you read about in the headlines. When they say, gee, we don't understand why John Doe went out and shot policemen or killed someone else. Well, oftentimes you'll see someone in their not too distant history where they had problems but they weren't in treatment. So my legislation says let's focus on what's in their minds and not just talk about what's in their hands. That with regard to guns, if we focus only on that, we are missing the point. Because you also have a lot of homicides that are made with a fist or a stick or a bat or a knife. You have half the suicides are with a noose or driving a car off a bridge or jumping off a bridge. We're not out there banning bridges or rope. What we need to do is focus on how we can help people. And by providing timely and focused care, it's far less costly than ignoring them or just rearresting them. But every 12 minutes in this country, someone dies by suicide. And think of this, that means every 13 minutes you have a new grieving family. And that ought to motivate us to do something.
Well, Congressman Tim Murphy, thank you so much for your leadership in this area. Where can people go to learn more about you and the legislation that you're advancing?
The legislation is called the Helping Families in Mental Health Crisis Act, HR2646, which passed the House by an overwhelming majority, 422-2 in July. We're hoping the Senate takes it up soon. And you can read more about it at my website, murphy.house.gov.
Outstanding. Thank you so much, sir.
Thank you.